to Guardian Home Care, where compassion meets expert caregiving. Today, we're diving into a critical health topic that affects millions of older adults, managing high blood pressure. Whether you're a caregiver, family member, or senior yourself, understanding how to control blood pressure can make a world of difference in maintaining quality of life. Stay with us as we explore practical tips, lifestyle changes, and medical insights to help seniors live healthier, longer, and more comfortably. Understanding high blood pressure. High blood pressure, also known as hypertension, happens when the force of blood against the artery walls is consistently too high. In older adults, arteries become less flexible, making it harder for blood to flow smoothly. This can quietly damage the heart, kidneys, and brain over time. Because symptoms often go unnoticed, it's sometimes called the silent killer. Regular monitoring is the first step in prevention. The role of diet. Diet plays a vital role in controlling high blood pressure. Encourage seniors to limit salt, processed foods, and sugary snacks. The DASH diet, rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy, is highly effective. Potassium-rich foods like bananas, spinach, and sweet potatoes help balance sodium levels. Hydration is equally important. Caregivers can prepare balanced meals and remind seniors to drink enough water throughout the day. Staying physically active. Light physical activity can lower blood pressure naturally and strengthen the heart. Seniors don't need intense workouts, just consistent movement. Simple exercises like walking, gentle yoga, or chair stretching can work wonders. The key is consistency and safety. Always consult a healthcare provider before starting new routines. Even 20 to 30 minutes a day can make a big difference. Managing stress levels. Stress triggers the body to release hormones that raise blood pressure. For older adults, stress management is crucial. Encourage calming activities like deep breathing, meditation, music, or reading. Spending time outdoors or connecting with loved ones also helps. Caregivers can create a peaceful home atmosphere. Soft lighting, gentle routines, and comforting conversations all play a part in lowering stress. Medication management. Many older adults rely on medication to manage hypertension. Caregivers must ensure medicines are taken on time and as prescribed. Missed doses or double doses can lead to serious health risks. Using pill organizers, reminder alarms, or tracking apps can help. Regular doctor checkups are essential for monitoring effectiveness and adjusting dosages when needed. Always avoid changing medications without consulting a healthcare provider. Recognizing warning signs. High blood pressure often has no symptoms, but when left uncontrolled, it can lead to dizziness, headaches, chest pain, or shortness of breath. If any of these signs appear, seek medical attention immediately. Caregivers should also watch for subtle behavioral changes. Confusion, weakness, or fatigue could indicate complications like stroke or heart strain. Awareness saves lives, so staying observant is key. Importance of sleep and rest. A good night's sleep helps the body regulate blood pressure. Poor sleep or sleep apnea can worsen hypertension. Seniors should maintain a relaxing bedtime routine. Dim lights, comfortable bedding, and limited caffeine. Caregivers can support by reducing nighttime noise and ensuring the room temperature is comfortable. Quality rest rejuvenates the heart and mind, leading to better overall health. Monitoring salt intake. Too much sodium causes the body to retain water, raising blood pressure. Seniors often consume excess salt through canned soups, sauces, and processed snacks. Encourage fresh home-cooked meals seasoned with herbs instead of salt. Reading labels is an excellent habit. Aim for less than 1,500 milligrams of sodium per day, unless advised by a doctor. Regular blood pressure checks. Monitoring blood pressure regularly gives caregivers and doctors valuable insights. Encourage seniors to check their readings at the same time each day. Home digital monitors are easy to use and help track progress. Record results in a notebook or mobile app. Consistent tracking helps detect sudden changes and allows early intervention before complications arise. Supportive relationships. Emotional support can make managing hypertension easier. Older adults thrive when surrounded by understanding caregivers, friends, and family. Encourage social connections. A short phone call, a shared meal, or a walk in the park can lift spirits and reduce blood pressure naturally. Loneliness and isolation, on the other hand, can elevate stress and worsen health outcomes. Compassion and communication truly heal the heart. The power of routine. Consistency builds stability. Seniors benefit greatly from a daily routine that includes set times for meals, medication, exercise, and rest. Predictable patterns reduce anxiety and improve body regulation. Caregivers can create a visual schedule or checklist that helps seniors feel in control. A simple, structured day supports both physical and emotional well-being. Natural remedies and cautions. Some natural remedies like garlic, hibiscus tea, or omega-3 supplements may support healthy blood pressure. However, always consult a doctor before adding any herbal or natural treatments. Some may interact with medications. The best natural medicine remains a balanced lifestyle, eat well, move regularly, and stay positive. Managing high blood pressure in older adults requires teamwork between seniors, caregivers, and healthcare providers. Small, consistent steps lead to lasting results. Remember, balanced meals, light exercise, good sleep, and emotional care are the true pillars of heart health. If you found this video helpful, please like, share, and subscribe to Guardian Home Care for more guidance on senior wellness and compassionate caregiving.
Welcome to Guardian Home Care, where we share practical health and safety tips to support seniors and caregivers. Emergencies can happen at any time, from power outages to sudden accidents or natural disasters. For older adults, being prepared isn't just about convenience, it's about safety and peace of mind. Seniors may face unique challenges during emergencies, such as mobility issues, medical needs, or communication difficulties. That's why today's video will guide you through the most important steps to prepare your home and loved ones. Let's explore how to build a safe, reliable emergency plan for seniors. The first step in emergency preparedness for seniors is creating a personal emergency plan. This should include important details such as a list of emergency contacts, medical information, and evacuation routes. Write down family phone numbers, doctor's contacts, and nearby hospitals. Keep copies in easy-to-find places like on the fridge or inside a wallet. Seniors who live alone should share this plan with neighbors or caregivers. A well-prepared plan ensures that in the middle of a crisis, there's no panic or confusion, just clear steps to follow for safety. One of the most critical parts of preparedness is keeping a medical kit ready. Seniors often need prescription medications, so an emergency kit should include at least a week's supply of medicines, labeled clearly. Add extra eyeglasses, hearing aid batteries, and medical equipment like inhalers or glucose monitors if needed. Don't forget basic first aid supplies, bandages, antiseptic, and pain relievers. Store everything in a waterproof bag that's easy to carry. Having medications ready can make the difference between stability and a dangerous situation during unexpected emergencies. Food and water are essentials. Seniors should keep an emergency supply of non-perishable foods such as canned vegetables, soups, peanut butter, and protein bars. Aim for at least 3 days' worth of meals. Water is even more important. Store at least 1 gallon per person per day for 3 days. Seniors may need more if they take certain medications. Don't forget a manual can opener, disposable utensils, and small snacks. By preparing these supplies ahead of time, seniors can stay nourished and hydrated even if grocery stores are closed or power is out. Power outages are common during storms or disasters. Seniors should prepare by keeping flashlights, extra batteries, and battery-operated lanterns in easy-to-reach spots. Avoid using candles as they pose fire risks. Consider investing in a small backup generator or a portable phone charger to keep communication lines open. Glow-in-the-dark stickers or night lights along hallways can also help prevent falls in the dark. Simple tools like these reduce anxiety and improve safety when the lights go out. Preparing for power loss gives seniors greater confidence during emergencies. Communication is another essential part of preparedness. Seniors should have a charged cell phone with emergency contacts programmed. For those who may struggle with smartphones, keep a simple phone with large buttons. A battery-powered radio is also helpful to receive updates when internet or TV is unavailable. Make sure caregivers and family know how to reach each other, even if cell towers are down. Having multiple communication tools ensures seniors are never isolated during critical moments. Staying connected means staying safe. Mobility is a big concern for seniors. In emergencies, having a safe evacuation plan is vital. Identify exits in the home and make sure they're clutter-free and accessible for walkers or wheelchairs. Keep sturdy shoes and warm clothing near the bed in case of sudden evacuation at night. If stairs are involved, arrange for assistance or install handrails. Practice the plan at least twice a year so seniors feel confident about what to do. Preparedness is not just about supplies, it's about being ready to move safely when necessary. For seniors with medical equipment like oxygen tanks or mobility scooters, planning is even more important. Ensure there's backup power or battery packs for essential devices. Keep instructions handy and share them with caregivers. Label each item clearly to avoid confusion during stressful moments. If relocation is needed, call ahead to shelters or family homes to check accessibility for medical devices. These steps prevent dangerous interruptions in care and ensure seniors remain safe and supported even in difficult circumstances. Home safety should always be reviewed as part of emergency preparedness. Install smoke detectors, carbon monoxide alarms, and fire extinguishers in key areas. Seniors should test alarms monthly and replace batteries regularly. Keep hallways clear to avoid falls, especially if moving quickly during an emergency. For those living in storm-prone areas, reinforce windows or keep storm shutters handy. A safe home environment reduces risks and keeps seniors confident when emergencies arise. Prevention at home is one of the strongest shields against danger. Lastly, emotional preparedness is just as important as physical preparation. Emergencies can cause stress, especially for seniors who may already feel vulnerable. Staying calm comes from being ready. Encourage seniors to keep comfort items such as family photos, a warm blanket, or a favorite book in their emergency bag. Caregivers should reassure loved ones, reminding them that preparation means safety. When seniors know they have a plan, their confidence grows and fear decreases. A calm mind is the strongest tool in any crisis. Thank you for joining us today on Guardian Home Care. We've covered practical emergency preparedness tips designed especially for seniors, from keeping medical kits ready and stocking food to creating evacuation plans and staying connected. Remember, preparation brings peace of mind and keeps loved ones safe in any situation. If you found this video helpful, please like, share, and subscribe for more senior health and safety guidance. Together, we'll continue supporting seniors in living safely, comfortably, and with dignity every day. Stay prepared, stay safe, and we'll see you in our next video.
Welcome to Guardian Home Care, your trusted source for senior health and well-being. Today, we're focusing on something incredibly important: eye health for older adults. As we age, our vision naturally changes, but with the right care and lifestyle choices, we can prevent many serious conditions like cataracts and age-related vision problems. In this video, we'll explore simple, practical tips to protect senior eyesight and keep life bright and clear. Why eye health matters. For seniors, maintaining good vision means maintaining independence. Simple tasks like reading, cooking, or walking safely rely on clear eyesight. Unfortunately, conditions such as cataracts, glaucoma, and macular degeneration are more common with age. The good news? Many of these problems can be prevented or delayed with proper care. Recognizing the importance of eye health early can make a huge difference in maintaining quality of life. Understanding cataracts. Cataracts are one of the most common causes of vision loss in seniors. They occur when the clear lens of the eye becomes cloudy, making it difficult to see clearly. This process often develops slowly over time and may cause blurred vision, faded colors, or trouble seeing at night. While cataracts are age-related, lifestyle choices and regular eye exams can greatly influence their progression. Symptoms to watch for.
It's important for seniors and caregivers to recognize early signs of cataracts and other vision issues. These may include blurry or double vision, sensitivity to light, difficulty seeing at night, or colors looking faded. Ignoring these symptoms can lead to accidents, falls, and reduced independence. Early detection through regular checkups is the first line of defense against worsening vision problems. The role of regular eye exams. Eye exams are vital for seniors. Doctors recommend a complete eye check at least once every year after the age of 60. These exams not only detect cataracts, but also screen for glaucoma, diabetic eye disease, and age-related macular degeneration. Regular visits ensure any changes in vision are addressed quickly before they become severe. Nutrition for healthy eyes. What we eat plays a big role in keeping our eyes strong. Seniors should include foods rich in vitamins A, C, and E, as well as zinc and omega-3 fatty acids. Leafy greens, carrots, citrus fruits, almonds, and fish like salmon are excellent choices. These nutrients protect the eyes from damage caused by free radicals and may slow down cataract development. Managing sun exposure. Just like our skin, our eyes are sensitive to harmful ultraviolet rays, or UV rays. Seniors who spend time outdoors should always wear sunglasses that block 100% of UVA and UVB rays. Wide-brimmed hats offer extra protection. Reducing UV exposure helps prevent cataracts and other vision problems. Protecting the eyes from sunlight is a simple yet powerful habit for lifelong eye health. Controlling chronic conditions. Many health conditions like diabetes and high blood pressure directly affect eye health. Seniors with diabetes, for example, are at higher risk for cataracts and diabetic retinopathy. Keeping blood sugar and blood pressure under control not only improves overall health, but also protects vision. Managing chronic diseases through medication, diet, and exercise is essential for clear eyesight. Exercise for better eye health. Regular physical activity increases blood circulation, which improves oxygen flow to the eyes. This helps reduce pressure in the eyes and lowers the risk of conditions like glaucoma. Seniors don't need intense workouts. Simple activities like walking, yoga, or stretching are highly effective. Exercise also supports overall health, which indirectly benefits the eyes. Avoiding smoking and excessive alcohol consumption. Smoking and excessive alcohol consumption can speed up cataract formation and increase the risk of vision loss. Seniors who quit smoking and limit alcohol intake can greatly improve their chances of protecting their eyesight. Proper lighting at home. Many seniors face vision challenges simply because of poor lighting in their homes. Bright, non-glaring light makes reading, cooking, and moving around much safer. Night lights in hallways and bathrooms are especially helpful. Proper lighting reduces strain and prevents accidents caused by unseen obstacles. Assistive devices for seniors. Even with the best care, vision may still decline with age. Assistive devices like magnifying glasses, large print books, and digital voice readers can help seniors continue daily activities. These tools allow older adults to maintain independence and stay connected with hobbies and loved ones. The importance of hydration. Many seniors don't drink enough water, which can lead to dry eyes and discomfort. Staying hydrated keeps the eyes moist and reduces irritation. Seniors should aim for 6 to 8 glasses of water daily, unless advised otherwise by their doctor. Adding fruits and soups also supports hydration and eye comfort.
Treatment options for cataracts. When cataracts significantly interfere with daily life, surgery is the most effective treatment. Cataract surgery is safe, quick, and highly successful in restoring clear vision. Many seniors regain independence and joy after their procedure. However, early care and prevention can delay the need for surgery for many years. Senior eye health is about more than just seeing clearly. It's about living fully. By scheduling regular eye exams, eating a healthy diet, staying active, and protecting eyes from sun and strain, seniors can enjoy brighter, safer, and more independent lives. Remember, caring for your vision is caring for your freedom. Thank you for watching Guardian Home Care, and don't forget to subscribe for more valuable senior health tips. Welcome to Guardian Home Care, where we bring you trusted tips to help seniors live safely, comfortably and independently. Today, we're focusing on one of the most overlooked aspects of senior health, foot care. Our feet carry us through life, yet as we age, they need extra attention to stay healthy and pain-free. So, let's explore how to prevent foot pain, infections, and injuries in older adults with simple, practical steps that make a big difference in everyday comfort. Why foot care matters. As we age, our feet naturally lose cushioning and elasticity, and circulation slows down. This can make seniors more prone to dryness, calluses, infections, and balance problems. Poor foot health can even increase the risk of falls, which are one of the leading causes of injury in older adults. That's why regular foot care isn't just about hygiene. It's about mobility, independence, and overall quality of life. By paying attention to foot health, seniors can keep walking with confidence and reduce discomfort in their daily routines. Daily foot inspection. The first step in proper foot care is daily inspection. Seniors or their caregivers should check both feet every day for cuts, blisters, swelling, or color changes. Use a mirror or ask for help if reaching is difficult. Spotting small issues early prevents them from turning into serious infections. Remember, even a tiny blister can become dangerous if ignored, especially for seniors with diabetes or circulation issues. Proper foot hygiene. Clean feet are happy feet. Seniors should wash their feet daily with warm, not hot, water and mild soap. Always dry thoroughly, especially between the toes, to prevent fungal infections like athlete's foot. Follow with a gentle moisturizing lotion, but skip the spaces between toes to avoid excess moisture. This simple habit reduces dryness, cracking, and irritation, keeping the skin soft and healthy. Nail care routine. Toenails should be trimmed straight across and not too short to prevent ingrown nails. Seniors with vision or flexibility issues should have a caregiver or podiatrist help with trimming. Avoid sharp nail tools and never dig into the corners. If nails are thick, brittle, or discolored, it may indicate a fungal infection that needs professional attention. Regular nail care keeps feet comfortable and reduces infection risk. Keep feet dry and comfortable. Moisture control is key. Seniors should wear clean, breathable cotton or moisture-wicking socks each day. If feet sweat a lot, using antifungal powder can help. Damp shoes or socks can quickly lead to fungal infections and odor. It's also important to change socks daily and let shoes air out between wears. Comfortable, dry feet make walking safer and more pleasant. Choosing the right footwear. Proper footwear can make all the difference. Seniors should wear shoes that fit well, have non-slip soles, and provide good arch support. Avoid narrow or high-heeled shoes that cause pressure and imbalance. Soft insoles and adjustable straps are great for swollen feet. Remember, ill-fitting shoes can lead to blisters, calluses, or even falls. If mobility is limited, choose shoes with Velcro closures for convenience. Exercise for healthy feet. Gentle exercises keep feet flexible and strong. Seniors can do simple stretches like pointing and flexing toes, ankle circles, or picking up marbles with their toes. These moves improve blood circulation and balance, reducing swelling and stiffness. Even short walks around the house can promote healthier feet. Always wear proper shoes and stop if pain occurs. Active feet are strong feet. Dealing with common foot problems. Common issues like corns, calluses, bunions, and fungal infections should never be self-treated with sharp tools or harsh chemicals. Instead, visit a podiatrist for proper care. Seniors with diabetes should pay extra attention since even minor wounds can become serious. Using cushioned insoles, maintaining good hygiene, and wearing proper shoes help prevent most problems. Prevention is far easier and safer than treatment. Importance of regular checkups. Regular podiatrist visits are essential for elderly foot care. Professionals can identify early signs of nerve damage, circulation problems, or skin infections before they worsen. A checkup every few months helps maintain comfort and mobility. Caregivers should also keep an eye out for swelling, redness, or changes in foot temperature. These can signal circulation or heart issues that need prompt attention. Promote safety at home.
Even healthy feet need a safe environment. Seniors should avoid walking barefoot, especially on slippery floors. Use non-slip mats in bathrooms, ensure hallways are well lit, and remove clutter to prevent tripping. Proper slippers with firm soles help maintain stability. A few small changes at home can prevent serious falls and injuries. Remember, safety begins under your feet. Caregiver support and routine. Caregivers play a vital role in maintaining foot health. Make foot inspection part of the daily routine, perhaps after bathing or before bed. Encourage open communication if pain, odor, or swelling appears. Simple daily attention not only prevents problems, but also gives seniors comfort and confidence. Caring for the feet is an act of love and respect for those who once cared for us. Healthy feet mean freedom and independence. By following these simple tips, cleaning, moisturizing, inspecting, wearing proper shoes, and staying active, seniors can enjoy every step of life with comfort and confidence. At Guardian Home Care, we're dedicated to helping seniors live their best life, one safe step at a time. Thanks for watching. If you found this video helpful, please like, subscribe, and share it with family or caregivers who might benefit. Visit Guardian Home Care for more senior wellness and safety tips. Together, we can make aging a little easier and a lot healthier.
Welcome back to Guardian Home Care Tips. Today, we're talking about how to manage senior anxiety and stress. Let's start the video. As we age, life often changes in ways that can be overwhelming. Many seniors face anxiety and stress due to health concerns, loss of independence, or even loneliness. At Guardian Home Care, we know how important it is to help our elders feel calm, safe, and supported. Managing senior anxiety is not just about medical treatment, it's about compassion, patience, and creating a reassuring environment. In this video, we'll explore practical tips and caring strategies to help manage anxiety and stress for older adults so they can enjoy their golden years with peace of mind. The first step in managing anxiety in seniors is understanding the signs. Unlike younger adults, seniors may not always express worry or stress with words. Instead, they may show physical symptoms like restlessness, trouble sleeping, headaches, or digestive problems. Some may seem withdrawn or unusually irritable. As caregivers, it's important to notice these subtle changes and respond with empathy. Remember, what looks like anger or forgetfulness may actually be anxiety or stress. Awareness is the key to support. Creating a calm environment makes a huge difference. Seniors often feel overwhelmed by loud noises, cluttered spaces, or sudden changes. A clean, quiet, and organized home helps reduce stress levels. Simple touches like natural light, soothing music, or a favorite chair by the window can promote relaxation. Caregivers should aim to create an atmosphere where the elder feels secure and in control. Sometimes a peaceful environment is more powerful than any medicine. Another powerful tool in reducing anxiety is routine. Seniors thrive on predictability. Having regular times for meals, medications, exercise, and rest provides a sense of stability. This minimizes uncertainty, which often triggers anxiety. Even small rituals like morning tea, reading a book after lunch, or a daily walk help build reassurance. Caregivers should respect these routines and encourage consistency to create balance in the senior's life. Physical activity is essential for reducing stress. Light exercise like walking, stretching, or gentle yoga improves mood by releasing endorphins, our body's natural stress relievers. For seniors with mobility issues, chair exercises or simple movements can make a difference. Exercise also promotes better sleep and reduces feelings of restlessness. Caregivers can join in, making it fun and encouraging seniors to stay active safely. Nutrition plays a vital role in managing stress and anxiety. Seniors should have a balanced diet with fresh fruits, vegetables, whole grains, and lean proteins. Limiting caffeine and sugar helps prevent jitters and mood swings. Hydration is equally important. Dehydration can cause confusion and irritability. A warm cup of herbal tea can be calming, especially before bedtime. Caregivers should prepare meals that are not only healthy, but also comforting and familiar. Breathing and relaxation techniques are simple yet effective tools. Teaching seniors to take slow, deep breaths can instantly calm nerves. Gentle meditation, guided relaxation, or even short moments of stillness can lower stress. Some elders enjoy listening to calming audio, while others prefer soft prayer or reflection. These practices help seniors regain control over anxious feelings. One of the greatest sources of anxiety in seniors is loneliness. Social connection is medicine for the mind. Spending time with family, friends, or community groups helps reduce feelings of isolation. Even short conversations or phone calls can lift spirits. Caregivers can encourage activities like playing cards, attending senior centers, or virtual calls with loved ones. Connection builds joy, and joy fights stress. Sleep quality is closely linked to anxiety. Seniors who don't rest well may feel more nervous or irritable during the day. Caregivers can encourage good sleep hygiene. Dim lights before bedtime, reduce caffeine, and avoid stressful TV programs at night. A consistent bedtime routine, like reading, warm milk, or quiet reflection, helps signal the body to relax. Proper rest restores calmness and reduces stress. For some seniors, spiritual practices bring great peace. Prayer, scripture reading, or attending religious services can ease anxiety and strengthen emotional resilience. Faith-based activities provide a sense of purpose and comfort. Even for those who are not religious, mindfulness and gratitude practices can calm the heart. Caregivers can support by respecting and encouraging these personal rituals. Hobbies and activities are powerful stress relievers. Seniors who engage in meaningful activities, gardening, painting, puzzles, or music, experience less anxiety. These activities distract the mind from worry and provide joy. Caregivers should encourage participation without pressure, allowing seniors to choose what feels rewarding. Joyful engagement brings calmness and self-worth. Sometimes professional help is necessary. Seniors struggling with chronic anxiety may benefit from talking with a therapist, counselor, or support group. Doctors may recommend safe medications if needed. Caregivers should never dismiss ongoing anxiety, but instead encourage professional guidance. With the right care, seniors can find hope and healing. To conclude, anxiety and stress in seniors are real challenges, but with patience and compassion, they can be managed effectively. Remember, observe the signs, create calm spaces, encourage routines, promote health, and nurture social connections. Seniors should feel safe, valued, and loved in every stage of life. At Guardian Home Care, we believe that managing senior anxiety begins with kindness. Thank you for watching, and don't forget to subscribe for more caregiving tips and guidance. Together, we can keep our loved ones safe, strong, and hydrated.
Welcome back to Guardian Home Care Tips. Today we're talking about a vital but often overlooked subject, hydration for seniors. As we age, our sense of thirst decreases, making it easy for elderly loved ones to become dehydrated without realizing it. Dehydration can lead to serious health risks, such as urinary tract infections, dizziness, kidney problems, and even hospitalizations. The good news is, with awareness and simple strategies at home, you can prevent dehydration and keep your loved ones safe, healthy, and energized. In this video, we'll share the warning signs of dehydration, practical hydration tips, and daily routines that make drinking water easier and more enjoyable for seniors. Why hydration is so important. Water is essential for every function in the body, regulating temperature, supporting digestion, protecting joints, and carrying nutrients. For seniors, hydration is even more critical. With age, kidney function slows and the body becomes less efficient at conserving water. Medications like diuretics or blood pressure pills can also increase fluid loss. When seniors don't drink enough, even mild dehydration can cause confusion, fatigue, and falls. Long-term dehydration increases risks of kidney damage and infections. That's why preventing dehydration isn't just about drinking water, it's about protecting independence and quality of life. When seniors stay hydrated, they think more clearly, move more confidently, and feel more comfortable. Common signs of dehydration in seniors. Dehydration doesn't always look obvious. Common warning signs include dry mouth, dark urine, headaches, and dizziness. Seniors may also show confusion, irritability, or sudden fatigue. In some cases, they might complain of muscle cramps or constipation. Because these symptoms are often mistaken for normal aging, caregivers need to stay alert. If you notice a senior urinating less frequently, feeling lightheaded when standing up, or having trouble focusing, dehydration may be the cause.
Recognizing these signs early helps prevent emergencies. How much water do seniors need? So how much water should seniors drink daily? Experts generally recommend about 6 to 8 cups of fluid each day. However, needs may vary depending on medications, activity level, or medical conditions. The goal is steady hydration throughout the day rather than large amounts at once. Remember, fluids don't have to mean plain water only. Broths, soups, smoothies, herbal teas, and water-rich fruits like watermelon or oranges all count toward hydration. By offering variety, caregivers can make hydration more enjoyable. Building a daily hydration routine. One of the best ways to prevent dehydration is by making drinking water part of a routine. Start with a glass in the morning, then pair fluids with meals and medications. Keep water within easy reach, whether by the bedside, on the living room table, or in a portable bottle. Encourage small, frequent sips rather than large amounts at once. Caregivers can even use reminders like phone alarms, sticky notes, or hydration apps to gently prompt seniors throughout the day. Over time, these small habits create a steady flow of hydration without overwhelming the body. Making water more appealing. Many seniors avoid water because they find it tasteless or boring. A simple solution is flavoring it naturally. Add slices of lemon, cucumber, berries, or mint leaves for a refreshing twist. You can also offer chilled herbal teas or diluted fruit juices. Serving water in attractive cups or colorful bottles can make it feel special and inviting. For those who struggle with swallowing difficulties, using straws or specialized drinking cups can make sipping easier. The goal is to make drinking fluids enjoyable instead of a chore. Foods that hydrate. Hydration doesn't always come from drinks. Many foods are naturally rich in water and can help seniors meet fluid needs. Watermelon, oranges, strawberries, cucumbers, lettuce, and celery are excellent choices. Yogurt and soups also provide hydration while adding nutrition. Incorporating these foods into daily meals makes staying hydrated effortless. For example, offering a fruit salad as a snack or serving soup as a starter before dinner can boost fluid intake without seniors even realizing it. Safety tips for seniors with health conditions. Some seniors have health conditions that affect fluid needs. For example, those with kidney disease, heart failure, or on fluid-restricting medications may need personalized guidance. In these cases, always consult a doctor before making major changes to fluid intake. For most seniors, the priority is steady hydration, but caregivers must balance medical advice with practical care. Keeping a daily log of fluid intake can help track progress and avoid complications. Encouraging seniors who resist drinking fluids. Sometimes seniors simply don't want to drink enough fluids. They may worry about frequent bathroom trips, swallowing difficulties, or just lack the habit. In such cases, gentle encouragement works better than force. Offer small amounts more frequently. Create positive associations, such as enjoying tea together or adding favorite fruit flavors. Caregivers can also explain the benefits in simple terms, like drinking water helps you feel stronger, or this will keep you from feeling dizzy. Connecting hydration to daily comfort and independence often motivates seniors to cooperate more willingly. Hydration is one of the simplest yet most powerful ways to support elderly health at home. By recognizing the signs of dehydration, building daily routines, offering appealing options, and encouraging small sips throughout the day, caregivers can make a life-changing difference. Remember, water is not just a drink. It's a key to energy, safety, and joy. Seniors who stay hydrated, think more clearly, avoid dangerous falls, and feel better overall. As caregivers, your role is essential. Every gentle reminder, every glass of water, and every supportive word builds health and happiness. Thank you for watching Guardian Home Care Tips. If you found this video helpful, please like, subscribe, and share to support other caregivers. Together, we can keep our loved ones safe, strong, and hydrated.
Welcome back to Guardian Home Care Tips. Today, we're talking about recognizing sleep disorders in older adults. Let's start the video. Sleep is essential for overall health, yet many older adults struggle with getting quality rest. While occasional sleepless nights are normal, frequent problems may signal a sleep disorder. Seniors often think it's just part of aging, but untreated sleep issues can lead to fatigue, memory problems, and even serious health risks. At Guardian Home Care, we understand how critical it is to recognize these signs early. In this video, we'll guide you through the common sleep disorders in seniors, what to watch for, and how caregivers can help. The most common sleep disorder in older adults is insomnia. Seniors may struggle to fall asleep, wake often during the night, or rise too early in the morning. Insomnia can be caused by medications, stress, or underlying health conditions. Left untreated, it leads to daytime tiredness, irritability, and even depression. Caregivers should pay attention to patterns of sleeplessness and encourage seniors to share how often it happens. Another serious condition is sleep apnea, where breathing repeatedly stops and starts during sleep. Seniors with sleep apnea often snore loudly, gasp for air, or wake up choking. They may feel exhausted even after a full night's rest. Untreated, sleep apnea increases the risk of heart disease, stroke, and high blood pressure. Caregivers should watch for these symptoms and encourage medical evaluation if they persist. Restless leg syndrome, or RLS, is another disorder often seen in seniors. It creates an uncomfortable urge to move the legs, especially at night. This constant movement prevents deep sleep, leaving seniors tired and irritable. RLS can be linked to iron deficiency, nerve problems, or medication side effects. Caregivers may notice seniors rubbing or shaking their legs while trying to rest. Recognizing this condition early can lead to effective treatment and better sleep. Circadian rhythm changes, the body's internal clock, also affect older adults. Seniors may feel sleepy earlier in the evening and wake up too early in the morning. While natural aging plays a role, disruptions can become problematic if they interfere with daily life. Caregivers can help by establishing consistent sleep routines and encouraging exposure to natural light during the day. Medications can contribute significantly to sleep disorders in older adults. Drugs for blood pressure, heart disease, or depression may interfere with rest. Some cause drowsiness during the day, but restlessness at night. Caregivers should review medications with healthcare providers if sleep issues arise. Often, simple adjustments can improve sleep without compromising treatment. Underlying health conditions can also trigger sleep problems. Arthritis pain, heartburn, dementia, or breathing issues may all disturb sleep. Seniors may not complain directly about pain, but instead show signs of fatigue, irritability, or confusion. Recognizing the root cause is crucial. Caregivers should carefully observe behavior and document changes to share with doctors. Poor sleep hygiene is another factor. Watching TV late, drinking caffeinated tea, or using bright electronic devices before bed can all make sleep harder. Seniors may also nap too much during the day, leaving them restless at night. Encouraging healthy habits, like dimming lights, limiting caffeine, and avoiding stimulating activities before bedtime can greatly improve rest. Recognizing daytime symptoms is just as important. Seniors with sleep disorders may seem unusually tired, forgetful, or moody. They may even fall asleep while reading, watching TV, or sitting quietly. These signs are often overlooked, mistaken for normal aging, but they point to disrupted nighttime rest. Sleepwalking and night confusion, also known as sundowning in dementia, are sleep-related behaviors that can be dangerous. Seniors may get out of bed, wander, or even attempt to leave the house. This not only disturbs sleep, but also poses safety risks. Caregivers should use night lights, secure doors, and maintain calm routines to reduce these episodes. To properly recognize sleep disorders, keeping a sleep diary is a helpful tool. Caregivers can record bedtime, wake times, naps, restlessness, and unusual behaviors. This information is valuable for doctors in diagnosing and treating sleep issues. Tracking patterns over time gives clarity and direction for the right care plan. Sometimes, seniors feel embarrassed about discussing sleep issues, thinking it's a minor problem. But untreated sleep disorders affect heart health, memory, and mood. Caregivers should create an open, supportive space where seniors feel comfortable sharing. Gentle encouragement and reassurance make a big difference. Professional evaluation is often necessary. Sleep studies, medical exams, or simple at-home monitoring can uncover hidden conditions. Doctors may suggest lifestyle changes, medication adjustments, or devices like CPAP for sleep apnea. Caregivers should advocate for seniors and accompany them through these steps, ensuring they feel supported and understood. Recognizing and addressing sleep disorders improves more than just rest. It boosts overall quality of life. Seniors who sleep well have better memory, stronger immune systems, and more energy for daily activities. For caregivers, this means less stress and more joyful moments. In conclusion, sleep is not a luxury. It's a necessity, especially for older adults. By watching for warning signs, promoting healthy routines, and seeking professional help when needed, we can ensure our seniors rest well and live fully. At Guardian Home Care, we believe restful nights lead to brighter days. Thank you for joining us, and remember to subscribe for more caregiving tips and guidance.
Welcome to Guardian Home Care, where we share practical health and safety tips to support seniors and caregivers. Emergencies can happen at any time, from power outages to sudden accidents or natural disasters. For older adults, being prepared isn't just about convenience. It's about safety and peace of mind. Seniors may face unique challenges during emergencies, such as mobility issues, medical needs, or communication difficulties. That's why today's video will guide you through the most important steps to prepare your home and loved ones. Let's explore how to build a safe, reliable emergency plan for seniors. Is your skin feeling dry, itchy, or uncomfortable as you get older? You're not alone. And the good news is there are simple ways to fix it. Welcome to Guardian Home Care, your trusted guide to living healthier and happier in the golden years. Our channel is dedicated to supporting seniors and caregivers with practical tips for everyday well-being. As we age, our skin loses natural oils and elasticity, making it prone to dryness and irritation. Seniors often notice their skin becoming flaky, itchy, or sensitive, especially on their arms, legs, and face. This isn't just cosmetic. Dry skin can cause real discomfort and even cracks that invite infection. That's why regular skin care is more than beauty. It's about health and comfort. Understanding these changes is the first step. With the right daily practices, you can prevent dryness and irritation and enjoy soft, nourished skin that feels good at any age. The foundation of senior skin care is hydration. Drinking plenty of water throughout the day keeps the skin moisturized from within. Seniors often drink less because they may not feel as thirsty, but dehydration directly worsens dry skin. Aim for 6 to 8 glasses daily, unless otherwise advised by a doctor. Herbal teas, water-rich fruits like watermelon, and soups also count toward hydration. Remember, healthy skin starts inside. Keeping the body hydrated is one of the simplest yet most effective ways to prevent dryness and irritation naturally at home. Another key to preventing dryness is choosing the right cleanser. Harsh soaps strip away natural oils, leaving skin tight and itchy. Seniors should switch to mild, fragrance-free cleansers or creamy body washes that are gentle on sensitive skin. Avoid hot water as well, since it worsens dryness. Instead, bathe in lukewarm water for 10 to 15 minutes. Adding oatmeal-based products or gentle bath oils can soothe irritation and lock in moisture. After bathing, pat, don't rub the skin with a soft towel. This small change makes a huge difference in comfort. Moisturizing is the heart of senior skin care. Right after bathing, when the skin is still slightly damp, apply a thick moisturizer to trap hydration. Creams and ointments are better than lotions because they're richer and longer lasting. Look for products containing ceramides, hyaluronic acid, or glycerin. Seniors with very dry skin may benefit from applying petroleum jelly on problem areas like heels and elbows. Daily moisturizing not only reduces dryness, but also helps prevent painful cracks and itching. It's a simple routine that promotes comfort and protects skin health. Don't forget about the air around you. Seniors often spend more time indoors, where heaters and air conditioners can make the air very dry. Using a humidifier helps add moisture to the environment, preventing skin from drying out. Place one in the bedroom or living area, especially during winter. Even small tabletop humidifiers can make a big difference in skin comfort. Combine this with keeping the thermostat at a moderate temperature to avoid drying the skin further. A balanced indoor environment is as important as skincare products. Clothing choices also affect senior skin health. Scratchy fabrics like wool can irritate sensitive skin. Instead,
Choose soft cotton or breathable fabrics that reduce friction and allow skin to breathe. Loose-fitting clothing helps avoid pressure marks and irritation, especially for seniors with fragile skin. Laundry detergents should also be gentle, fragrance-free, and dye-free to avoid allergic reactions. Even something as simple as what you wear every day can support healthy and comfortable skin. Remember, comfort and protection should always come first. Thank you for watching today's video on senior skincare tips. By staying hydrated, moisturizing daily, choosing gentle products, and protecting against sun and dryness, seniors can enjoy healthier, more comfortable skin at home. Remember, caring for your skin is caring for your health. If you found these tips helpful, please give this video a thumbs up, share it with someone who could benefit, and subscribe to Guardian Home Care for more health and wellness guidance. Together, we'll continue supporting seniors in living their best lives with comfort, dignity, and care.
Welcome to Guardian Home Care, where we focus on supporting seniors and their families with practical, everyday solutions. Today's topic is all about safety, specifically how to prevent falls at home. For many older adults, the risk of falling increases with age, and a single accident can impact independence and health. But here's the good news. By making simple adjustments at home, seniors can enjoy a safer, more confident life. Let's explore how small changes make a big difference in fall prevention. Why fall prevention matters. Falls are one of the leading causes of injury among seniors, often resulting in broken bones or hospital visits. But beyond the physical impact, falls can also create fear, limiting a senior's independence. By focusing on prevention, families can reduce risks and help seniors continue enjoying daily activities without constant worry. Safety doesn't have to mean major renovations. Simple steps often make the biggest difference. One of the simplest adjustments is keeping pathways free of clutter. Shoes, rugs, cords, and small furniture can quickly become tripping hazards. Seniors benefit greatly when floors are clear and walking spaces are wide and open. Families can help by regularly tidying and rearranging items to ensure smooth movement from room to room. Proper lighting. Poor lighting is a hidden risk for falls. Seniors should have bright, even lighting throughout the home, especially in hallways, staircases, and bathrooms. Night lights are especially useful for late-night bathroom trips. Warm, non-glaring lights make it easier for aging eyes to see clearly. A well-lit home reduces hesitation and accidents. Safe flooring choices. Slippery or uneven floors can be dangerous for seniors. Avoid throw rugs or secure them with non-slip pads. Bathrooms should have slip-resistant mats, and shoes with good grip are better than walking barefoot or in socks. Safety begins under our feet, and stable surfaces give seniors peace of mind with every step. Handrails and grab bars. Installing handrails and grab bars is one of the most effective safety measures. Stairs should always have sturdy rails on both sides, while bathrooms benefit from grab bars near the toilet and inside the shower. These supports provide stability and help seniors feel more secure during daily activities. Safe bathrooms. Bathrooms are high-risk areas for falls due to slippery water surfaces. Installing raised toilet seats, walk-in showers, and handheld shower heads can greatly improve safety. Seniors should also keep essentials within reach to avoid stretching or bending. A safe bathroom setup encourages independence while reducing accidents. Sturdy furniture and seating. Unstable chairs or low furniture can make it hard for seniors to sit or stand safely. Homes should have sturdy, comfortable seating at the right height to support ease of movement. Armrests are especially helpful for balance when getting up. Choosing the right furniture can eliminate everyday risks. Organizing frequently used items. Seniors should not have to climb, stretch, or bend to reach everyday items. Place commonly used objects like medications, kitchen utensils, and clothing at waist or shoulder height. This small adjustment reduces strain and keeps seniors safe from dangerous falls caused by overreaching. Managing cords and wires. Loose cords from lamps, televisions, or appliances can easily trip seniors. Families should secure cords against walls or use cord organizers. Wireless options can also help reduce clutter. A neat, hazard-free environment makes walking safer and more enjoyable for older adults. For homes with stairs, safety must be a priority. Non-slip stair treads, bright lighting, and sturdy handrails on both sides are essential. Seniors should avoid carrying heavy items while climbing and instead use small bags or baskets. With adjustments, stairs don't have to be a constant danger. Adaptive tools and technology. Technology can play a big role in fall prevention. Motion sensor lights, medical alert systems, and smart home devices help seniors stay safe. Simple tools like reachers or long-handled grabbers also minimize the need for bending. These adjustments combine safety with independence. Safe footwear. Footwear makes a huge difference in stability. Seniors should wear shoes with non-slip soles and proper support. Slippers or flip-flops may feel comfortable but can increase fall risks. Choosing the right footwear can prevent accidents while still keeping seniors comfortable. Staying active for balance. While home adjustments are crucial, seniors should also work on maintaining balance and strength. Simple exercises like stretching, yoga, or walking improve flexibility and stability. The stronger the body, the less likely falls will occur. Home safety paired with activity creates true fall prevention. Falls may be common, but they are not inevitable. With small changes like adding lights, securing rugs, installing grab bars, and organizing the home, seniors can live with greater safety and confidence. Guardian Home Care encourages families to make these adjustments today for a brighter, fall-free tomorrow. Thank you for watching, and don't forget to subscribe for more tips on senior health and safety.
Welcome to Guardian Home Care, where we share practical tips to help seniors live healthier, safer, and more comfortable lives. Today's topic is an important one: swallowing difficulties, also known as dysphagia. Many older adults face challenges when eating or drinking, which can make mealtime stressful and even dangerous if food goes down the wrong way. But with the right care strategies, seniors can enjoy meals more safely and comfortably. In this video, we'll explore causes, signs, and helpful tips to manage swallowing problems at home. Let's begin with understanding why swallowing difficulties happen. Swallowing difficulties in seniors can result from many factors. Conditions like stroke, Parkinson's disease, dementia, or weakened throat muscles make swallowing harder. Sometimes dry mouth, medications, or even dental problems contribute to the issue. Recognizing these underlying causes helps caregivers provide the right support. Swallowing is something we usually don't think about, but for seniors, it can become a daily challenge. By paying attention to changes in how seniors eat, we can take steps to prevent choking, aspiration, and malnutrition. Understanding the why is the first step towards safer mealtimes. One of the first signs of swallowing trouble is coughing or choking during meals. Seniors may also complain that food feels stuck in their throat or chest. Other signs include frequent throat clearing, difficulty chewing, or taking unusually long to finish meals. Sometimes weight loss or dehydration happens because eating feels too difficult. Caregivers should pay attention to these red flags and not dismiss them as just aging. Identifying swallowing difficulties early helps prevent more serious complications. Monitoring daily eating habits can make a life-saving difference for seniors. One helpful tip is to adjust food texture. Soft foods are much easier to swallow than dry or tough items. Options like mashed potatoes, scrambled eggs, yogurt, oatmeal, and smoothies are excellent choices. Avoid foods that are crumbly, sticky, or hard, such as crackers, peanut butter, or raw vegetables. Some seniors may need their food pureed or finely chopped. Texture modification makes eating safe and enjoyable instead of stressful. With the right preparation, even favorite meals can be adjusted to reduce the risk of choking. Liquids can be just as challenging as solid foods. Thin liquids like water or juice sometimes move too quickly, causing coughing or aspiration. Thickened liquids, which flow more slowly, are often easier and safer. Caregivers can use commercial thickeners or natural ingredients like fruit puree to adjust consistency. Drinking from a cup is usually better than straws, which can push liquids too fast. Always encourage slow sipping and upright posture during drinking. Making these small changes prevents accidents and makes hydration safer for seniors. Positioning plays a critical role in swallowing safety. Seniors should always sit upright at a 90-degree angle during meals and stay upright for at least 30 minutes afterward. Leaning back or lying down increases the risk of choking and aspiration. If sitting in a regular chair is difficult, supportive cushions or adjustable chairs can help. Proper posture allows gravity and muscles to work together, making swallowing smoother and safer. A simple seating adjustment often makes mealtimes far less risky. Encourage seniors to take small bites and slow sips. Rushing through meals increases the chance of food going down the wrong way. Smaller spoonfuls, smaller bites, and resting between mouthfuls give more time to chew and swallow safely. Caregivers should create a calm, distraction-free environment during meals. No rushing, no television, just focused eating. Gentle reminders to chew thoroughly and swallow completely before the next bite are simple but powerful ways to reduce risk. Slow and steady always wins when it comes to safe eating. Moisture makes food easier to swallow. Adding sauces, gravies, or broths to meals helps prevent dryness. For example, serving chicken with broth or pasta with sauce makes swallowing much smoother than dry meat or plain noodles. Soups, stews, and casseroles are wonderful meal options that combine nutrition with ease of swallowing. Caregivers should also offer frequent sips of fluid during meals to keep the mouth moist. Making food soft and moist turns eating from a struggle into a comfortable experience. Oral health is closely linked to swallowing. Seniors with missing teeth, poorly fitting dentures, or mouth sores often struggle with chewing. Regular dental checkups and proper mouth care make eating much safer. Encourage seniors to brush their teeth, clean dentures, and keep the mouth moist. Sometimes artificial saliva sprays or sugar-free lozenges can help with dry mouth. A healthy mouth means stronger chewing ability, less pain, and smoother swallowing. Caregivers should never overlook dental care as part of supporting safe eating. Finally, professional guidance is key. If swallowing difficulties are severe, caregivers should consult a doctor or speech-language pathologist. These specialists can recommend safe swallowing exercises, diet modifications, and medical treatments. In some cases, they may prescribe swallowing therapy to strengthen muscles. Remember, every senior is different, and personalized advice ensures the safest care. Guardian Home Care encourages families to seek professional support whenever swallowing issues interfere with nutrition or safety. Working together, caregivers and healthcare providers can make mealtimes safe and enjoyable again. Thank you for joining us today on Guardian Home Care. Swallowing difficulties may seem overwhelming, but with the right strategies like adjusting food textures, thickening liquids, maintaining proper posture, and encouraging slow eating, seniors can enjoy meals safely at home. Remember, mealtime should be nourishing, safe, and enjoyable, not stressful. If you found this video helpful, please like, share, and subscribe to Guardian Home Care for more senior health tips. Together, we'll continue supporting seniors with the comfort, dignity, and care they deserve. Stay safe, eat well, and we'll see you in the next video.